see from the front slide here, we're really lucky to be joined by James Parks from PAPYRUS, and I know James will tell you more about himself and what PAPYRUS do as an organisation, and I'm sure he'll get around to telling you about some of the training that's available at the moment. So without further ado, we'll be waiting for Dr Gill Kelly as well to join us afterwards to talk about the new self-harm and suicidal ideation pathway as well. But without further ado, let me hand over to James, who's going to talk you through the work of PAPYRUS.
Thanks very much. Welcome everyone. I'll just share my screen. Hopefully this will work. Is that come up, Steph?
Yes, perfect,
yeah.
James, well done.
So yeah, a massive thank you for the partnership reaching out. For me, it's really nice to be back in North Yorkshire, where I've spent all of my career previously coming to PAPYRUS. So based in Ripon, and have worked in North Yorkshire for nearly 20 years before coming to PAPYRUS 2.5 years ago. Those that are not familiar with PAPYRUS, so we're the Prevention of Young Suicide, a charity that specialises in suicide prevention of under 35s. Our organisation was formed by a group of parents who sadly lost their children to suicide, and they didn't want other parents to feel the pain and the suffering that they had. And also they didn't want their other children to feel that there was nowhere to turn to. So they created the then Parents Association of the Prevention of Young Suicide. And since then, 28 years in the making, we have evolved and still provide life-saving services, which I'll talk through in a little bit more detail as we go through the presentation. As I say, my journey really kind of started with the Safeguarding Children's Partnership, where I used to manage the Safeguarding Children's Partnership and oversee the child death overview process. And before that, 15 years before that, had never really come across suicide. And sadly, through the CDOT process, had 6 or 7 individual cases that came to our attention where it was suspected suicide. And it really struck a chord with me. I spent time with bereaved parents, and bereaved parent introduced me to PAPYRUS at the time. Again, a charity I've never heard of or never come across. And since then, I've kind of followed the PAPYRUS as an organisation. We've done work within the Safeguarding Children's Partnership, looking at how we can reduce the number of young people who were struggling with thoughts of suicide, but also how we could prevent deaths from occurring. We introduced the suicide and self-harm pathway, which I know will be kind of touched on a little bit later. So as I say, for me, it's really nice to be here back in North Yorkshire, being able to sort of share now the work that we're doing as a team across the UK. So we're a UK-wide. I manage the England North locality, which is the North East, North West, and Yorkshire and Humber teams, and I have individual suicide prevention officers who are delivering suicide prevention training, attending events in schools, in universities, workplaces, in the community, raising the profile of the work that we do. Just going to show you a short video here. So hopefully that gives a flavour of the type of work that the organisation undertakes. I suppose a bit of a health warning, really. Obviously, you've signed up knowing that this is an overview of suicide prevention, and appreciate that as individuals, we all might be affected or bereaved by suicide ourselves. So if people do want to reach out for some support, I'll share some information about our Hope line. I will stay on at the end of the call as well if people want to have a chat. If you do want to take yourself off, or like I say, take some time away. I appreciate talking about suicide can affect different people in a variety of different ways. So we heard there that suicide is the biggest killer of under 35s within our community, and that was very much the case when our founding parents set up the organisation 28 years ago. Sadly, we're still seeing a number of suicides within our population. I'm just going to touch on a little bit of information around sort of the magnitude of suicide. So just looking at our data, so as I said, we're a UK-wide charity, so we take data from England, Wales, Northern Ireland and Scotland. When we compile that together, 2023 is the most up-to-date data collectively. Some of the nations produced annual data, but kind of because we are UK-wide, we want to make sure that we're talking about that UK figure. The figures that I'm going to be sharing, I just really want to kind of put a plea really to remember that these are individuals who have lost their lives to suicide. We use data to highlight a positive or a negative in information, but just realizing and remembering that each of these numbers that we talk about are lives lost to suicide. When we talk about suicide data, we use the coronial process data. So a coroner has to deem a case to be a suicide death. The people who died in the people that are registered in 2023 may not have died within that year. And that's really important to realise that if an individual has a suspected death of suicide, it can take 3 months, 6 months, a year, or even 2 or 3 years to get to inquest. And it's only at that time when that death is recorded as a suicide death. So these aren't individuals who have died within 2023, but have been registered within that that time scale. So when we look at sort of the total numbers of suicides of all ages in 2023, sadly 7,468 individuals lost their lives to suicide. So registered deaths of suicide, 7,468. When we look at that number from a young person's point of view, and in the eyes of PAPYRUS, young person is under 35, that figure is 1,840 individuals who have taken their own life as registered by suicide. That's 1,840 families that have been affected, schools, workplaces, the ripple effect of suicide. Research suggests that there's 135 individuals that are affected by every one death. If that death is in, say, a school setting, obviously that number will be far greater because of the number of people that are within that community of that young person. Or if that individual is a celebrity, again, that magnitude of the ripple effect of suicide can be into the tens of thousands, if not millions, of people who are affected in some way, shape or form following a death by suicide. And then we move into the number of registered suicides of teenagers. And this is around 250. And sadly, this, if I was doing this on 2022's data, around 200 teenagers died by suicide. So we see that sort of rise in the number of teenagers that have died by suicide within 2023. And the data continues to increase. It has plateaued for some time. We're not seeing the decrease in number of deaths that we would hope for, and we need to be maximising every effort to talk about suicide, reduce the stigma, and share messages of hope, and that there is support that is available for individuals. In terms of support from PAPYRUS, and I appreciate this is a very quick overview of the work that we do. If you don't take anything away from today's session, other than Hopeline 247, Hopeline 247 is a 24-hour helpline that is available to anyone who's got thoughts of suicide or has got some suicidal ideation and they would like to speak with an advisor. They can speak on the phone, they can text, they can email, and they can web chat our services. As I say, that's available 24/7, free of charge. And as long as the person is aware of Hopeline exists, then they can access that. We've also introduced a BSL service, so if British Sign Language is the first language of an individual, they can access our services through our main website, and there is a link on there to access the BSL interpretation service. And also we have Language Line, which is available in up to 200 different languages, where, again, appreciating that people's language, English might not be the first language, they can still access those that information. So when we talk about Hopeline 247, remember it's phone, text, email, web chat, and then there's the BSL service and Language Line services available. Our advisors are available to speak to. They're all paid members of staff who work on our calls and are all trained in ASSIST, which I'll come on to in a little while, which is the sort of globally recognised suicide first aid training. In terms of who can access Hopeline, it's available, as I say, for those that have got thoughts of suicide or those that are in immediate crisis in terms of wanting help to understand and work through their thoughts of suicide. It's also available for what we call caregivers or supporters, so people like yourselves, teachers, nurses, fire service, anyone who comes into contact with someone who may have thoughts of suicide. Parents that can use the service to say, I'm working with James, he's expressed thoughts of suicide, we've talked about this, we've done this, is there anything else that you could help or support with? And then also it's there in a debriefing capacity. So if you have done an intervention or if someone has sadly taken their own life, you can ring Hopeline and talk through those experiences well. So there for the individual, there for you as the caregiver, and there as a debriefing service for individuals. This is something I wish I knew when I was working in North Yorkshire doing the child death overview process. I wasn't aware that these things, so waking up at 2 o'clock in the morning, having never really ever known the individuals that we were dealing with in terms of through the CDOT process, just I recognised the trauma and the I suppose vicarious trauma that it had as me as a professional, and I've never been bereaved by suicide, but I would say I've been affected by 7 suicide deaths before coming to PAPYRUS, and just recognising that impact on us as professionals. It's all. When we talk about kind of putting your own oxygen mask on before helping someone else, it's really important that we do look after ourselves and that we've got the skills and the ability to debrief and get our support so that we can help people in our community. It's really, really important. So please promote Hopeline 247 far and wide. We have materials, and I'll touch on a little bit on the website, details of how you can download information or request literature and information to be sent out. We've got posters and Hopeline cards and all sorts of different ways to get those messages out to young people, predominantly under 35, who can access the Hopeline services. So I'm just going to move swiftly on to a couple of extra things. So as a charity, we sadly have had to launch an emergency appeal. We're seeing nationally, and not just necessarily with us as an organisation, but a lot of charities are struggling financially because we are solely dependent on the generosity of individuals within our communities. So we don't get any government grants, statutory grants, or things like that. We have to apply for funds or commission work to maintain our services. So if anyone feels that they would like to donate, then feel free to share the information. It's on our website, and you can offer opportunities, or if you're aware of other opportunities that we can apply for, then very much gratefully received. Moving into the suicide prevention training aspect, and I'm really pleased to be able to offer North Yorkshire colleagues, and I appreciate we might have some people who work or live in other areas, so City of York. I'll pop in the chat a free link really to suicide prevention. So we've been working with our colleagues in public health with Dan Atkinson, who leads on the suicide prevention agenda, and our partners in the ICB, who have commissioned us to deliver some suicide prevention training across the North Yorkshire footprint. We've also likewise got a similar offer in the City of York, and we've got things in Doncaster, we've got things in East Riding, so kind of a variety of different opportunities for people to access. And it's always good, I know, having worked in a partnership, people don't necessarily have lots of money to provide training, so if there's free stuff, grab it while it's there. I'd love to get all our courses full with 30 people and report back to our funders that these are available. And I know the partnership have been promoting these courses, so thank you for that. So just in a very quick fire sort of rundown of our different courses, we have our Spark course, which is what we're doing today. It's a presentation rather than a training course in itself, an overview of who we are and what we do. We then have sort of Spot, which is your level 1, Speak, which is your level 2, and Assist, which is your level 3. So Spot is a 90-minute training session that goes into the introduction to suicide. Speak is a 3.5-hour training session, which goes into a lot more information and kind of provides you with a way to safety plan. So how you can support an individual who is saying that they don't want to be here, they maybe want to take their own life or have got thoughts of suicide. You can learn how to safety plan with that individual. And that is a really vital sort of resource. And then we have Assist, which I mentioned earlier, which is the gold standard of suicide prevention training. And that's a 2-day in-person training course where the other Spot, Speak and Spark are online or face-to-face delivery. So there are limited courses available. So if you do want to increase your knowledge in suicide prevention, then book on the courses while you can. I've put another link there to other areas, so you might live in other parts of Yorkshire or the country, or I've got colleagues that live in those areas. Please feel free to share the information. It's been great seeing people share stuff on LinkedIn and getting our messages of hope and that training is available, Hopeline is available to anyone in those geographical areas. So that just kind of highlights the second link I've put there, which is you can see a rundown of available funded courses that are available in the area. And it's always nice to come to an area and say, actually, we don't want your money for training. If there's stuff here that you can access amongst your organisations, then even better. So that's very much a whistle-stop tour of that. And I know I've got a couple of minutes left, so I'll just kind of touch on influence. If I said the word influence, you might think, oh, I'm not an influencer. I'm an influencer. I'm not a YouTuber, social media influencer. I don't have millions of followings, but I'm influencing you today. I'm having a conversation with you about suicide and suicide prevention, trying to normalize a conversation, reduce the taboo of the subject. And we've got many, many influencers in our communities, be that teachers, young people, employers. We've got some high-profile individuals who are sharing our messages. We've got 3 incredible dads walking, who've been doing an amazing amount for suicide prevention that you may have seen on the recent news, who are campaigning for suicide prevention to be mandated in schools. Again, these individuals have been there, they've been through bereavement, the loss of their children, and using that to empower others to take action and to try to prevent suicides happening in our communities. So you are all influencers, and what I'd like you to do is to have a conversation with one other person after today's session, so that you can influence them, and then we can start that influence ripple in our communities. Tell someone about social media, on social media about PAPYRUS. Have a chat with a colleague at the office. You can have lots of different meaningful conversations in a variety of different areas and arenas. And just coming towards the end of my section, really, resources. We've got a plethora of resources on our website. You can access them. They're all downloadable. They're fully translatable, and you can print them off. You can request sort of posters, materials. I've been to a few conferences recently with the partnership in Harrogate, distributing leaflets and materials. We'll be attending the DSL, Designated Safeguarding Leads conference later in this year as well. So if you do want materials on bereavement, self-harm, sexual orientation, dealing with individuals, parents' guide to suicide prevention. If you work in schools, we've got schools guides. So a real mix of resources, which I've popped the link into the chat, and you can download those free of charge and at your leisure. And we're also kind of constantly looking at new resources, new materials that we can get out into those communities as well. So just to finish off, I appreciate it's been a bit of a rush through a whistle-stop tour of PAPYRUS, but please remember Hopeline 247 is available to anyone who's got thoughts of suicide, supporting an individual with thoughts of suicide, or have been involved in an intervention to prevent someone from taking their life. Also, please do talk about suicide. By talking about suicide isn't going to make someone take their own life. It might offer the opportunity for them to reach out and get that support. Access our resources. As I say, they're free of charge. We've got a variety of different ones that you can have access to. If you are interested in supporting us as an organisation, be it doing a bake sale at school, or doing running a marathon, or jumping out of a plane with a parachute on, whatever, we're always on the lookout for individuals to do some amazing work to keep our work going for the future. We also have opportunities to volunteer. So we have a wonderful group of volunteers who, again, are getting our messages out into their communities and providing an opportunity to have those open and honest and safe conversations about suicide prevention. And particularly for North Yorkshire, as we've got that fully funded training, please utilise that. Please share it amongst your colleagues, trusts, organisations. For me, I want to get as many bums on seats as we can in those training courses. That just leaves me to say a massive thank you, and I'll hand over to Steph for the next part. Happy to take any questions. If you want to pop them in the chat, I'll reply to them, so we can kind of move on to the next area of business.
Thanks, James. I'm sure we'll all agree that was really, really interesting, really thought-provoking. And we really appreciate your time today. Lovely, perfect timing as well. It's like you've done this before. So moving on, I'm delighted to let you know that we are joined by Dr Gill Kelly, who I can just see her just popped her camera on today, and she's going to spend the rest of the session talking to you all about the prevention of suicide and self-harm in children. So over to you, Gill.
Thank you very much, Steph. Can I just check you can hear me? I'm in the middle of Easingwold at the moment, so I just want to make sure that it's all working.
Loud and clear.
Excellent. I'm just going to share my slides. Hopefully all will work, because I'm having to run off my phone. So everything seems to be working so far there. So I would actually
That's very impressive.
I'm just going to actually repeat though what we've just been hearing. I think it's really important when it comes to suicide prevention that actually you'd undertake the formal training. What I'm going to actually do today is give a brief overview of the actual local picture, the local context, and then also look at the new guidance that's just come out on, well, it first came out in April and then was updated on the 11th of June. So it is very, very much hot off the press. Now, I am going to be going into a lot of specific details, and so I'm not going to go into them all today, because honestly, this is something that should really take all day to talk about and learn about and understand. So what I'll do is, obviously, you can see the slides at a later date, you can go through them, and hopefully what I've tried to do is is take quite a long piece of guidance and legislation and actually put it into more manageable slices so that it becomes more understandable. So what I just want to do first of all, though, is actually say what we have here on the left is what I would say is the most important thing when it comes to talking about suicide and self-harm prevention. It's a safety net, and a safety net cannot be held up by one single person alone. This is to do with everybody who is involved with any child or family actually all working together in conjunction, because everybody brings another piece of information, another little bit of the puzzle, and together we actually can provide that safety net for that young person. Okay, please work. There we are. So ultimately, we all have a collective responsibility and a collective risk. And we should be asking, if not you, who? Well, it really does need to be all of us working together. And actually, I think that's one of the most important things when it comes to supporting families with this and children. So just to give you a little bit of background on the road so far, we get lots and lots of data around local data, national data, and we can look at the risks of young people with poor mental health. And I think it's something really important to talk about that. It must be, though, a year or so ago where I was contacted by somebody within the Safeguarding Partnership about reviewing the actual guidance that was on the website. And I have to admit, I'm a simple bod. I like pathways. I like something really easy, something very simple, telling me what to do and when. And in all honesty, there's just too much information out there. There is just so much. It's so much on the safeguarding website. There's so much if you actually look up what kind of guidance is actually available through the NHS England, through government. There is just, especially National Institute for Health and Clinical Excellence, NICE, produce huge amounts. And it's actually really difficult to know where the really important messages are coming from. So hopefully I will try and give you a little bit of steer around the important messages today. But like I say, there is no way that this is a substitute for proper formal training. And I would urge you all to go on the PAPYRUS training because of that. Hopefully, though, I'll give you a bit of steer today. What I have done is looked at some of that suicide prevention guidance that's just come out. What I've also done is look at some of the guidance that came from Tees and Wear Valley NHS Trust, who provide most of our mental health support services from that very much that risk management part of the NHS. And they were very, very helpful in providing almost a list of information that we need from young people and their families when thinking about where a young person is at that point in time. I am touching a teensy bit on self-harm at the end, but only a teensy bit, because in all honesty, that needs to be a whole separate bit. There is so much on this, and it's such a complicated and very emotive topic. And again, just to repeat what's just been said, keep yourselves safe. Oxygen masks for us first. Can see this is going to be a problem. There we are. Right. First thing I want to do is touch very briefly on the Growing Up in North Yorkshire survey data from 2024. I would say this photo, which actually is my own youngest son, along with my nephew, representing one of the most important aspects of keeping young people safe, having a trusted adult to talk to. And I absolutely love this picture because ultimately it is the perfect, my own son there is 18, so technically he's an adult, but it doesn't have to be a parent. It doesn't have to be a carer. It can be a teacher, a social worker, a youth worker. Anybody who is that trusted adult in that young person's life can actually provide that stabilizing influence. But even at the age of 6 and 7 in year 2, we are finding that children are worrying. And we've even got 1 in 5 worrying about the way they look, although it is actually slightly down from 2022. So we're heading in the right direction. What we're then finding in year 6 is that fewer young people feel they've got somebody to talk to. And also, there's only 83% think it's important to go to school. So it's important that we actually emphasize that safety net within the school environment, being surrounded by peers, being surrounded by adults who are trusted. We've got worse outcomes, it has to be said, for children with special educational needs. And as you can see, 74% have somebody to talk to versus 85% of children without special educational needs. And it's also the same when it comes to going to school. So, yeah, we just need to make sure that we're providing all children with that trusted adult. And it doesn't, like I say, it doesn't have to be a parent or a carer. When we look at the worries that year 6 are showing, death of a close person. Now, we thought that back in 2022, it was the same. We thought that actually might be something specific around COVID, but this is still something that we are seeing. And you wonder, is it just that greater understanding of mortality when they get to about the age of 10? Interestingly, we've now got the increase in girls worrying far more than boys about everything. When we look at the resilience and well-being, the things to take away from this is that we've still got far too many children who are just given special educational needs, and also far more children with special educational needs in that really low well-being scale that can indicate really poor mental health. It just means, I think, with that you should also be thinking, if you are dealing with somebody who has disclosed to you that they're thinking of self-harming or they're thinking of taking their own life, there are certain things that you need to be heightened awareness, shall we say. Now, I'm not going to ask, because there's far too many people to do this, and I certainly don't have enough time to do this, but I thought it'd be interesting just to show you the characteristics that are coming out as greatest for having poor mental well-being. And the biggest one is being a young carer. So that one comes across loud and clear. Special educational needs and being in armed forces families are also important. Single parent family, free school meals. And by the way, all of these are statistically significantly greater risk of having poor well-being than the whole of the North Yorkshire population, who are 10 and 11. And then finally, being a girl. Boys are far, far better with their mental well-being than girls at the moment. And this is something very much since COVID, we have seen boys' well-being increasing brilliantly. Nothing really happening like that with girls. And just the reason I'm concentrating as well on special educational needs is if we look at, these are the national figures that were just released last week around the number of children with education, health and care plans and with special educational needs support, but without a plan. We are looking at over 1.7 million pupils in England alone who have special educational needs of some kind. That is vast. And it just worries me that there is going to be a tsunami coming of children whose fragility and lack of resilience means that this can become an increasing problem in terms of suicide and self-harm risk as well. When we move into secondary school, far fewer pupils have somebody to talk to, so 1 in 3 pretty much don't. Far more with special educational needs. And we know that we've got about 1/3 of girls in our survey missing school in that previous month due to poor mental health or worries about school and bullying. It's no worse than 2022, but it's still far too many. We do know again, though, that school has such a protective effect. It really is important to try and keep young people in that school community. Children are still worrying lots. Girls far more, particularly around the way they look. So again, that's something to be really concerned about. The other thing that really just is highlighted for me here is the level of loneliness. 1/3 of girls feel lonely. That to me, really, yeah, that's one of the ones that tugs your heartstrings, really, I think. And then when we look at the resilience of young people in secondary school, you can see that it's just still not quite improving the way we would want it to. Well-being, however, particularly in boys, is getting better. We do know that they're there. In fact, boys at secondary school is back to how it was kind of 2014 levels. It's much better. Overall, though, the figures are brought down because girls just aren't improving the way we would like them to. Of note, there has been a significant reduction in young people who've had thoughts of self-harm and suicide. So it's still, though, 1 in 3 of our secondary school pupils has actually ever had thoughts of self-harm. So yes, it's much better than 38%, but it's still far, far too high. So this is something to keep an eye on, and we do keep a very close eye on that in public health. And then just something that you can have a look on at a later date, the difference between boys and girls across the year groups. And then again, we can look at the characteristics greatest for poor well-being. Now, of note, when we look at these, there's a couple of them where the actual numbers who are answering the survey are so small, it's a little difficult to say just how statistically significant the results are, but it is important to acknowledge they're there. So children in care and transgender children have the greatest levels of poor well-being. So basically their well-being is the worst. Now, like I say, though, the numbers are pretty small, so we don't know just how true a reflection they are. However, the next one, and this one is statistically significant, is being LGB. After that, we've got armed forces families. And again, this is greatest risk of having that low well-being score. Special educational needs, long-standing illness, free school meals, single parent family, and finally, being a girl. We're really just not seeing that improvement in well-being that we would like to in girls. There's a very, very different level of well-being when you split them. And then just very quickly, within year 12, we're seeing roughly the same patterns, although slightly more have somebody to talk to, but we still do have young people, far too many young people missing school because of their mental health and well-being. So these are kind of things that we just need to be wary of when we're talking to young people who have disclosed to us that they are thinking about self-harm or suicide. And then finally, we've got their well-being and resilience. And it is very much, again, girls generally tend to do far worse than the boys. So this is how we've been really getting onto the meaty stuff here. How do we actually help? Now, we just need our definitions between self-harm, suicidal ideation, and what a crisis is. So self-harm is, and this is the nice definition, is that self-poisoning, self-injury, irrespective of the apparent purpose of the act. Suicidal ideation, also known as suicidal thoughts, thinking about suicide, and there is a huge spectrum there. And then there we've got the definition of crisis. So that's that perception or experience of an event or situation as intolerable difficulty that exceeds the person's current resources and coping mechanisms. So as I said before, this can never be a single agency or a single person's responsibility. So it's so important that we ask who it is around that young person who can provide that stabilizing influence. Who is it that they trust? And as I mentioned before, there is new guidance. Now, it's supposed to be specifically for healthcare professionals. However, so much of it is actually based on that social environment in which a young person lives. And there is very, very little direct guidance specifically coming out for non-healthcare professionals. In all honesty, I would say that this is probably the best stuff we've got. And it is a really, really good gold standard. But like I say, I would urge you to do the PAPYRUS training. So the main principles that are coming through this, and I'm sure you're going to recognize all of this, is that there is a shift towards a more holistic, person-centered approach. This is not rocket science. This is really, really important ways in which we can support young people and their families. It's ultimately, we can do a risk prediction, but it literally is just gauging the risk in that particular moment. And there is increasing evidence that somebody's intentions can change literally minute to minute. So there is absolutely no way that we can say, oh, well, they don't have X, Y, and Z, so therefore we don't need to refer them to an agency because they're not at risk. The fact is that any risk putting that we do only gives you that risk at that moment. 5 minutes later, it can be completely different. So ultimately, if anybody is worried at all about a child or their family in any kind of situation, we have to do something about it. And that's why it's so important to understand the situation and manage their safety. And it's ultimately safety that we're talking about here. But there needs to be collaboration across the whole of the mental health system, as well as with all of the agencies that are involved and in contact with young people. So what we're actually finding, though, is that there really is a low-risk paradox, because most of the people in contact with mental health services who actually die by suicide have been assessed as being of low risk. So therefore, what they're actually saying now is don't use risk assessment tools. But it doesn't mean to say you can't gather huge amounts of information and actually look at the safety net around that young person at the time. But this is why we really need to actually recognise that contribution of non-healthcare professionals, because in all honesty, you are as important, if not more so, than the mental health services that are there, because you're the ones in contact with people all the time and understand the situation far more. So there are 10 key principles actually outlined in the guidance. Now, the vast majority of it is non-medical, and that's why I think it's really important that we can look at this today. I'm not going to go into all of this, though. I'm really not, because it is a huge amount of information. But trusting relationships, consider the social aspects. There are safety assessments that can be done, and that is very much about looking at what's happened, why it's happened, what are the risk factors, what are the things that actually mitigate against that risk. There's lots of things that can be done around safety management. There's all sorts of things that can be done around looking at those changing needs and circumstances. So that's that dynamic understanding. And actually, that's really important. And that's where I think teachers and social workers in particular are incredibly important to understand that actually when that young person is in contact with, say, just off the top of my head, say grandma, then that is what can that can really set them into a state of distress. So understanding then that they're going to see grandma, or there's a visit planned, or there wasn't a visit planned, or a birthday, something as simple as a birthday is what can actually cause significant distress. So it is that understanding of those circumstances at that point. Certainly, evidence-based practice is at the heart of everything we do, but it's also important to understand those broader risk trends. And that's where the gunny data becomes really important. And that's why I thought it was really important to actually show you what the relative risks are in terms of the whether someone's a young carer or in the armed forces family. All of these things contribute to that broader understanding of safety around that young person. The most important thing on here for me is involving others, of getting that safety net, of getting everybody around, and actually then making sure that everybody knows what's going on. We have to make sure that we're inclusive with everything we do, and also that we communicate really well. And it's important that when we're communicating that we're not talking in jargon. And honestly, I don't think there's any organisation that doesn't have its own acronyms, but certainly health and social care and schools are very good at doing all that. And I have to say, sometimes I'm having to look things up, but we always improve what we do, and we always try to improve all the time. There we are. So the 3 elements, I'm not going to go into them in too much detail right now. There's safety assessment, formulation, and then management and planning. And the actual document itself goes into these in far more detail. I'll go into them in a little bit more detail in a minute, but I just want to put down, these are the relevant questions that the CHUV mental health worker suggested would actually really inform understanding what's happening And as you've been hearing from PAPYRUS, and sometimes people can really appreciate being able to answer these questions, being able to kind of give that kind of description of how they're feeling and what's happening. Sometimes we're having to get information from families, though, not the actual young person themselves. So sometimes having that external viewpoint of a young person is also such an important bit of the jigsaw puzzle. So just to really just have a look at them, it's very much around what's happened, what the impact of what may have happened or what they want to happen, what's the impact of all those worries on life, what kind of risk-taking behaviors are happening, has that person acted on them, and if so, what was that level of action? Is it something that's increasing? And evidence that you think that the severity will increase if somebody doesn't jump in immediately, that's a real red flag. I mean, certainly all of these in severity with a hugely severe kind of level would be red flags in themselves. Again, you have to ask about any thoughts that they've been having and any specific planning. Those personal or social circumstances can make all that difference in understanding that. What is the behavior doing? What's its function? Is it a coping mechanism? And what level of support network is available for that young person? And what have they accessed? Are they a risk to themselves or others? And do they have a diagnosed mental illness? Now, the best way around this kind of communication, though, is open questioning. So no tick box, no kind of yes or no answers. It's so important to actually let somebody tell you in their time and not to really have that conversation shut down by closed questioning. Of the safety formulation that they're recommending, there's 3 Ps, although they do add 2 extra in. So I'm not sure, I think it really should be 5, but they talk about 3. The presenting problem, the protective factors, so what's reducing that risk of acting on suicidal impulses, and that's your positive relationships or distractions. What is it there? What are the precipitating factors? And this is the kind of thing that I was talking about before. You know, it could even be just something as simple as a birthday or something happening in their life. Can look at the predisposing factors and the perpetuating factors. And they actually even talk about things like if there is an addiction underlying, that's a stable factor, but it is maintaining problems. So the warning signs, though, that really are very much red flags is that researching methods and feelings of hopelessness. So that's the stuff that is coming through loud and clear from this new guidance. Information shares, but there's got to be a level of confidentiality. Now, confidentiality, you want a young person to feel that can actually share information in that confidential way. However, if there is an immediate risk to life, and they need to know this, there is a duty of information sharing that will override everything. Risk to life is the one place where confidentiality goes out the window. And I can say in my previous role within emergency medicine, this was something that we encountered quite a lot, and we often had to actually say, look, this is so important, and it's so important to maintain somebody's actual risk there that we have to refer them on. So those 3 areas that the documentation talks about, the safety management and planning. I'm not going to go into that in a huge amount of detail because I don't have time. And like I say, this is something that really is more important through formal training. And we're looking at whole days practically with all of this because there is so much that is really important. But again, that bit in the middle, involve trusted others. That collective responsibility to have collective safety, I think, is vital. And you can have a look at all of these things. Like I say, I've tried to break down a rather complicated piece of guidance into something really manageable. So within North Yorkshire, for young people, we base our mental health support system on the I Thrive model. One thing I will acknowledge is that it's messy. It really is. We've got Compass seeing young people with mild to moderate needs. We've also got the 0 to 19 servicing the young people with mild to moderate needs. And we've also got wellbeing in mind in schools, otherwise known as mental health support teams. And it can be really difficult to actually know who is the best person for this young person's needs. I'm not even going to go into Bentham because it just gets really complicated with 3 different integrated care boards covering our area. But we have to think about what support we've got in each of our areas. That is the system as it currently stands. The green at the top is the advice. Then you've got blue around getting help. Right at the bottom there is for your young people who are at the greatest risk. And through all of this is the impact of special educational needs, the influence of schools in terms of the pastoral and support that is given there, and the voluntary sector. And of note, our mental health transformation team that we've got for young people at the moment that is looking at the whole of this system and trying to make it far simpler for people to know exactly where to go, when to get a timely response for young people. That is just a very brief and simplified version of where all the different parts of the system sit. And when we actually look at how we access each of those, that is roughly the main commissioned NHS side of the support system. The 2 things I want to draw attention to here is that the professional advice line, the single point of access for CAMHS from CHUV, no longer exists. What we have instead is specific phone numbers for different areas. So the numbers are on there and they are accurate as of 2 weeks ago. And the other thing is the professional advice line for Compass on the left of your screen there. And that is that phone number that any professional can phone up for advice on any age of child that they are worried about. And that is something really, really important to note. And here we have PAPYRUS smack bang in the middle of the other organisations that I've included there. And it's very important to actually have all of these things in one place and lots of different ways of accessing support. Very briefly, we've got information on the safety planning, and that's looking at the warning signs that we've already mentioned, coping strategies, distraction, professional support, and lots of engagement from others. We can also identify environmental safety. The other thing that I want to just very briefly touch on, I've only got a couple of slides left with a couple of minutes to go, is the self-harm NICE guidance. And I'm really not going to mention very much on this because, again, this is a whole other session. But what is interesting is that within that NICE guidance, they've got specific bits for non-healthcare professionals. And they are mentioning that it's a case of looking at self-harm injury severity, thinking about the level of distress, so the mental state of a young person, whether or not they're an immediate safety concern, because that immediate safety concern, that trumps confidentiality. Remember, that is the one thing that does. Safeguarding concerns, again, it's that immediate safety, whether or not a young person has a care plan already in place, and whether or not a mental health referral is needed. Personally, I think if there's any concern at all, you phone Compass's advice line. You cannot be too careful in this area. And there are 3 broad principles, again, very familiar: collaborative, collaborative, collaborative. Getting advice as much as possible, and always remember to offer social care support or teaching support, anything we can to have that wraparound holistic model of care around a young person. And those are my references. So those are the 2 big documents. They are very large, very complicated, but I would urge you to have a good look at them. Hopefully I've managed to represent them nicely in that very, very quick run through there.